Welcome, everybody. My name is Andrea Bucalato. I'm Program Manager of the Complementary Care Program. And today we welcome Diane Kelsey, who's going to speak to us about calcium and cancer. Is there a connection? Diane?
All right. Thanks so much, Andrea, for that introduction. And yes, welcome to all of you. And today we are tackling the big topic of calcium and cancer, and is there a connection? Seems like a straightforward topic, but as you dive deeper and deeper into it, there's just more and more little things out there that I've tried to kind of simplify for you. Andrea, I have one question for you. Can you get everybody's pictures off of the screen because it's kind of blocking my slide?
Okay, what you want to do, Diane, is click on speaker view. So on the top right, there's a little tiny box and then a box next to it, top right. And if you click on the second box, you'll get just you on the screen as the speaker.
Oh, goodness. Okay, top right. It says more. Okay, wait. You know what? I don't see that, Andrea. I'm just going to go ahead and talk with the.
Okay.
Yeah, I'll do it. I know my slides well enough to finagle my way through here. So, it's not advancing either.
Okay, you want to click on your bottom left of your screen and you should find your toggles to advance it.
Oh, okay. That's not where I usually use it. Anyway, there we go. Perfect. Okay. All right, everybody. Sorry about that. But here is an overview of what we're going to try to cover today. We're going to start out with information. We're going to talk about what calcium is. We're going to review how much we need. We're going to talk all about the foods that are good sources. Then we're going to dive into the supplements. And then finally, the second part of the talk, we're going to really examine what role does calcium play with cancer. And at the end, we're going to try to draw some conclusions and hopefully answer some of your questions and walk away with some sort of useful information.
Diane, I just want to mention, can everyone please mute themselves? Thank you.
Okay. Good to go. All right, starting off, calcium, maybe our first introduction to calcium was back in our high school chemistry class. It may kind of give you some nightmares, or maybe you had to memorize that periodic table of elements, calcium, atomic weight of 20. So that might be where it all kind of started, but general facts about calcium. It is the most abundant mineral in the body. And 98% of that makes up the bones and the teeth. And I think most of us do associate calcium with our skeletal system. So it kind of goes hand in hand, but it does a lot more than just the bones. It keeps our tissues strong and flexible. It's involved with muscle function, blood vessel contraction and dilation, blood clotting, nerve transmission, and hormone secretion. So calcium's kind of got a hand in all kinds of stuff that's going on there. And calcium does not act alone. There's all these complex feedback mechanisms going on. It works kind of hand in hand with magnesium and protein and phosphorus and potassium, vitamin K, vitamin D. The list is long. Few more facts about calcium. We know that it's found in some foods. It's also added to other foods. It's present in some medications that we might take, like antacids, and it's widely available as a dietary supplement. Another kind of fun fact about calcium is that it is absorbed less efficiently as we age, which is kind of a bummer, but that's just one of the many reasons we need a little more as we get older. So how much do we need? This is the recommended dietary allowances, the RDAs for calcium, and I've highlighted it for adults. 19 to 50 years old, both men and women are looking at a goal of around 1,000 milligrams daily. If you're in that 51 to 70 age range, men still get to stay at 1,000, but women bump up a little bit to 1,200, and that's mostly due to the hormone shifts of menopause and the increased risk of bone loss that's kind of starting to occur at that time. And if you're older than 70, both men and women are targeting about 1,200 milligrams daily. And it's important to point out too that this is what you want to get from food and supplement combined. You wouldn't want to take this much in supplement and then also have a diet that's really high in calcium. So we'll address that a little bit more as we go. One question that might come into your head is, well, if some calcium is a good thing, is more even better, but is there such a thing as too much calcium? And the short answer is yes. There's actually an upper safe limit, and that's defined as 2,000 milligrams daily for those older than 51 and 2,500 milligrams daily for those ages 19 to 50. So you don't want to overdo it with the calcium. What might happen if you were getting crazy amounts? First and foremost, kidney stones. If anyone has ever had this happen to you, it's not an experience that you want to repeat. So calcium can play a role in that. Constipation, kidney failure, heart function problems, confusion, all of these would be unfortunate side effects of too much. And then there might be milder symptoms like headache and fatigue that could be, attributable to all kinds of different things. Dairy. When we all think of calcium, we generally think of the dairy group, and for good reason. Dairy products do contain a lot of calcium. An ounce of cheese, a cup of milk, a cup of yogurt, you're looking at, 200 to 400 milligrams just in that serving size. So if you're a big dairy eater, you're probably getting plenty of calcium. But it's not just contained in the dairy products. There's a whole world of calcium options out there, and plenty of plant foods and seafood even do contain it. So there's lots of different ways to get it. Spinach, bok choy, tofu. Now, tofu has it, but there's a huge range that within different types and brands of tofu. So you may get a lot in your tofu, or you may get a minimal amount. Reading the label is important there. Nuts, seeds, soybeans, fortified things like orange juice, cereal, they're all good sources. However, there is a catch, and it's called bioavailability of calcium. All right, so we're going to kind of dive into this and explain it a little bit more. Now, bioavailability refers to the amount of calcium that is actually absorbed. The amount on a label will tell you how much is in a food, but bioavailability is how much actually gets into your system. Dairy products have 30% bioavailability. All right, so if the label says there's 300 milligrams in a cup, about 100 is going to actually get into your system. Plant foods contain less calcium, but they have higher bioavailability. Bok choy is the example that we're using. It contains about, half my screen is blocked here, so I can't read it, but I think it's 160 milligrams per cooked cup. And 50% of that is going to get absorbed. So you're going to get the 80 milligrams into your system, which is pretty good. However, there is an important exception or caveat to plant foods. Many of them contain substances called oxalates and phytates. And what these do is they bind calcium in your gut and they make it less available to you. I'm using spinach as my example here. A cup of cooked spinach has 260 milligrams of calcium, which sounds really awesome, but spinach is sky high in oxalates, all right? And there's so much in there that it lowers the absorption down to 5%. So you're only getting essentially 13 milligrams of that 260 in your spinach. But I'm not saying don't eat the spinach. It's awesome on so many other levels, but calcium, need to be aware of that. Vitamin D and C also are going to help somewhat with calcium absorption, going to enhance it a little bit. So I mentioned high oxalate foods. I'm just highlighting a few examples of some of these. And the problem here is these are really healthy foods. So you hate to tell anyone not to eat these foods, but just be aware they have oxalates, can interfere with that absorption of calcium. If you've ever had a kidney stone, you might be told to avoid these foods, which as a dietitian, it's really hard for me to encourage that piece of it, but there you have it. Okay, wait a minute. Okay. My slides are not going as I want them to, but they will, don't worry. There we go. Calcium absorption. Important to understand how calcium is absorbed in our system. All right. Most of the calcium is absorbed in the duodenum, which is the very first part of the small intestine, right after the food leaves your stomach. It's that section where 90% of calcium absorption happens, okay? I'll explain a little later in the lecture why this is important. If you've had maybe some sort of GI surgery or you have bariatric surgery where we're going around and altering this makeup of your intestines, you might be missing out on a lot of really good calcium benefits. Okay. Now I'm going to address calcium supplements. These are just widely available in every store, every drugstore, everywhere you look online. And there's really a lot to understand with the supplements because they come in all kinds of different types, shapes, forms. They're marketed in different ways where you might think they're telling you this one's better than that and whatnot. So let's take a closer look at it. Calcium carbonate is by far the most common form, the cheapest form, and it's also the most available form in terms of amount of calcium in the pill. So if you're able to take carbonate, that's the direction that you want to go. 40% elemental calcium in that particular form. The second most common form is calcium citrate. All right, this has 21% elemental calcium, so still getting a pretty good bang for your buck. You might also see these other products, calcium lactate, calcium gluconate, and both of those have very minimal elemental calcium, so it wouldn't be worth it to choose those products. You might be asking about coral calcium derived from the coral reef. The concern here is it has a higher risk of heavy metal contamination. It is mostly made up of carbonate, contains some magnesium. It tends to be more expensive, but there would no evidence whatsoever that this would provide superior benefits, regardless of what the marketing people might tell you. I want to highlight a couple of things here because in a former life here at Dartmouth Hitchcock, I had to work with our bariatric patients, and because they lost their duodenum there during the procedure, we had to super supplement them with calcium. And it's tricky. Reading labels is very tricky. Caltrate is an example of calcium carbonate, which is the preferred form if you can tolerate it. Looking at a label, one pill contains 600 milligrams of calcium. So you would literally need 2 pills a day to fully meet your supplement needs, assuming you got none from your diet. Looking at the citrate form, you need 2 pills to get 630 milligrams. And trust me, these are not small pills. These are like horse pills, all right? So you're looking at 4 pills daily from this. So label reading is very, very important. The reason you would take a citrate and not a caltrate, if you don't have stomach acid, or if you're going to have to go with this form because you need your stomach acid to get the caltrate form absorbed. We can only absorb like 500 to 600 milligrams at a time too, so hence the reason for the split dosing. There can be side effects with supplements, all right? They're usually well tolerated, but we do see them causing gas, constipation, and bloating. Carbonate is most likely to cause these problems. So if you're taking a supplement, you notice that you're not tolerating it too well, you might want to try a citrate form. prescriptions can interact with calcium supplements, blood pressure meds, thyroid hormones, antibiotics, calcium channel blockers. So just more things to be aware of. More facts. All right, here we go. The supplement industry, unfortunately, is not regulated by the Food and Drug Administration. So what that means is what the label says is in a product may not actually be in that product. You have no way of knowing unless it's been third-party tested. So when you are buying a supplement, you want to look for what I call kind of the seal of approval on the label. The most common thing you're going to see is this USP verification symbol. There's also the NSF and CL that are third-party. They do third-party testing and verify what's in supplements. So when you're shopping for your calcium, look for that on the label. As I just mentioned, also, calcium needs to be taken in smaller doses of 500 to 600 milligrams at a time. You can't just dump the 1200 in your system all at once. It just doesn't work very well that way. If you're taking the carbonate form, the cheapest and most readily available, you want to take it with your meals. You need that stomach acid to get it absorbed. If you take a citrate form, it can be absorbed with or without food. And it's a better choice for someone with reduced stomach acid or certain GI issues. Calcium supplements come in a huge variety of forms and options. There's tablets, capsules, chews, liquids, powders, gummies, you name it. The important thing is just to know what you're taking, reading the label to get and knowing the dose that you're getting. Now, who is most likely to actually need a calcium supplement? Because if you have a really good diet, you do not need this, all right, a diet adequate in calcium. But if you're on a vegan diet, you may or may not be getting adequate calcium from your foods based on all those phytates and oxalates that are interfering with absorption. Anyone with lactose intolerance or anyone that doesn't eat a lot of dairy might be at risk. If a person consumes ridiculous amounts of protein or high amounts of sodium, this is also going to increase calcium excretion from the body. Anyone on long-term use of corticosteroids like prednisone, you're at higher risk. Certain bowel disorders like celiac disease, irritable bowel disease, and like I mentioned, the surgical patients who have had their GI tract altered. And then certain cancer patients, which I'll have a slide further in, might be on some medications that are increasing bone loss. Calcium regulation. What's actually happening in the body? Well, calcium is very tightly regulated in the blood of healthy individuals. And that's all thanks to these 4 little parathyroid glands that are located in our neck. They secrete PTH, which has all these different feedback mechanisms that tightly control our calcium in our blood in that small little range. So one misconception sometimes is you think if you eat a lot of high calcium foods or if you don't eat enough calcium, it's going to affect your blood levels. That is not true. It's all about the parathyroid gland keeping things where they should be. Same thing with sodium levels. Your body knows how to keep your blood sodium right in a certain range. So eating more salt or sodium or less does not affect those levels. And I've had a lot of people confused over the years with that particular feedback mechanism there. It's good to know that there are medications that can mildly raise your blood calcium. This isn't a real common or thing or something you really actually need to worry about, but diuretics, lithium, vitamin A and D intoxication, or even if you're popping Tums all day long, it can mildly elevate your blood calcium levels. All right, so what is actually going on? Let's say you go to the doctor and you're getting your blood work checked and you think you're a healthy person, no problem. And then it comes back with a high calcium level. And normally your body knows how to keep it right in the right range. So what might be going on here? Doctor's going to think of one of two things. Either you've got some hyperparathyroidism going on, or then they might look deeper and think there could be some cancer going on. One big red flag, if it's hyperparathyroidism, they're going to see high calcium and they're going to see high PTH in your blood. If they see high calcium in your blood and low PTH, they might get a worried look on their face and they're going to send you for some more tests. So why would the blood calcium levels be higher when cancer is present? There are two basic reasons. If the cancer has already spread to your bones, it's causing a release of calcium into the blood. And then again, the tumor itself can secrete a PTH-like hormone that will interfere with normal calcium levels. So those are the two things that kind of relate to high calcium and cancer in the blood. Elevated levels are seen in 20 to 30% of all cancer patients, and usually by the time they identify it, cancer has already spread. Certain cancers are more apt to cause high calcium. Myeloma is kind of at the top of the list with 30%. But we see it in breast cancer, lung, kidney, and prostate cancer most often. Let's say your blood levels are high. How are you going to feel? You're going to probably feel really tired, really weak. Your appetite's going to be down. You might be constipated. Your concentration might be off. There could even be some confusion or some irritability. So those are kind of general symptoms, but that is one way that it might show up. Now, we're going to specifically look at a couple of the hormone-related cancers and bone loss and why your doctor may or may not tell you to go on calcium supplements if you're in this category. Those with ER-positive breast cancer, all right, hormone-positive breast cancer are usually put on medications called aromatase inhibitors, all right, the anastrozole, the letrozole, extremistane. And what these are doing to your body is, in addition to the effects of blood loss that you might get with normal menopause, these medications accelerate it and make it much, much more amplified. So if you're a breast cancer patient, that is the reason why your doctor or nurse practitioner is really emphasizing that you get enough calcium in your diet. And enough means around up to that 1,200 milligram amount. It doesn't mean going crazy. So I work a lot with the breast patients here, and I just tell them in terms of calcium, make sure you're achieving that target with diet and supplements combined, all right? Our men with prostate cancer might be on ADT therapy, androgen deprivation therapy, where your testosterone levels are getting lowered and you unfortunately kind of go into that female menopausal state where bone loss becomes more of a concern. So it's possible that your doctor might recommend you take a calcium supplement. And this is where it gets really frustrating as we get further into this talk, because we do hear that, hey, calcium doesn't, calcium promotes prostate cancer, so why would I take more of it? And that is a very legitimate, difficult to answer question. So for the final section of this talk, what I've decided to do, because there's so much crazy, confusing information out there, there are thousands, tens of thousands of studies to look at. So I chose 8 studies and just decided to kind of highlight what's out there, what have they looked at, and what conclusions did they come to. I really tried to simplify this because I can't stand listening to a talk where people go through every little detail of every little study. I just want to hear the basics, and then what did you find out? So we're going to start off with this study number 1, published very recently in 2022. And what they did is they looked at dairy consumption and the risk of cancer in China. Cancer is much more rare in China, and they don't eat as many dairy products as we do. So it's kind of looking at a different group of people. They examined 500,000 subjects from both urban areas and rural areas. The study ran for 11 years, so it's pretty long. And I want to point this next point out to you, that they collected their data using food frequency questionnaires. So they're basically asking people, how often do you eat certain foods, all right? And then they would repeat these over the years. The problem with this way of gathering data is that it's self-reported, so the accuracy is always in question. So that's something to really keep in mind, because most of the studies I'm going to talk about, that's how they gather their data. It's what you tell them you're eating. They don't lock people away in a lab for 10 years and you only get the food that they give you. It's very open-ended there. They looked at factors like age, sex, education, income, BMI, family history, smoking. So they looked at lots of different things and factored all of these in. And in this group, only 20% consumed dairy, usually milk, and they call it regularly at 81 grams daily. And I had to look up what 81 grams was, and it's only a third of a cup. So that's not a whole lot. But this conclusion is a little concerning to me. They found higher liver and breast cancer rates were seen in those consuming dairy. No association with colorectal cancer, and a slight increase with lymphoma. All right, so this is just one snapshot, one study where they're kind of telling you dairy products may not be a good idea. Study number 2, published in 2020. This one looked at dairy, soy, and the risk of breast cancer specifically. Lots of subjects here, over 52,000. These were North American women who were cancer-free at the start of the study. They were followed for 8 years. And again, the intake data was gathered from these food frequency questionnaires and 24-hour dietary recalls, where they just ask you what you ate in the last day. And I don't know about you, but I always have trouble remembering what I ate this morning. So question the accuracy of that too. But over 1,000 of these subjects developed breast cancer during the follow-up. And what they found was higher rates of cancer were reported with increased dairy milk intake. No association though with soy, cheese, and yogurt. So that's good information, good feedback there. And they didn't find a difference between premenopausal and postmenopausal women. So there you have it, that study. Study number 3, American Journal of Clinical Nutrition, published just last year, Adventist Health Study. They looked at dairy, calcium, and the risk of prostate cancer. Okay, so this is relevant. 28,000 subjects from both the United States and Canada. Diet was also measured with those food frequency questionnaires and the 24-hour diet recalls. They found over 1,200 prostate cancer cases during their 8 years of follow-up. And their findings were that the men with higher intake of dairy foods, but not the non-dairy calcium-containing foods, had a higher risk of prostate cancer compared to those with lower intakes. And it was nonlinear, suggesting the greatest increase at relatively low doses. So there's that. Study number 4, a little bit older of a study, but this looked at diet, medical history, and lifestyle of over 120,000 men and women. And the conclusions that they found that those with the highest intake of calcium from both food and supplements had modestly reduced risk of colorectal cancer. So here we get into the area of calcium is good to prevent colorectal cancer, but it's bad for prostate cancer. It's conflicting all over the place. The benefits appeared to plateau around 1,200 milligrams daily. When diet alone in this study was analyzed, there was no reduction. So the supplements seem to have a stronger effect than the diet, but that's just in this particular one. Study number 5. They looked at does dietary calcium interact with dietary fiber against colorectal cancer. This was conducted in Poland, and about over 1,500 hospitalized patients. It was a double-blind study, I believe. They used food frequency questionnaires to collect their data, and they also accounted for physical activity, BMI, smoking, etc. And they found that the subjects consuming greater than 1,000 milligrams of calcium daily had quite a significant decrease in their colon cancer. So this is a real plug for calcium and helping out with colon cancer. And the fiber enhanced the relationship. So there again, fiber, I guess, good on so many different levels. Study number 6 looked at calcium intake and the risk of colon cancer. And they looked at almost 88,000 women, 47,000 men, and the food frequency questionnaires, once again, were their data collection method of choice. 16-year study. So it's an older study, but it went on for a long time. They identified 1,025 cases of colon cancer during this time. And it's pretty significant that what they saw here, calcium intake greater than 700 milligrams daily suggested a 35 to 45% reduction in cancer compared to those with a calcium intake of lower than 500 milligrams. So plug for calcium on this one with colon cancer. And number 7, study number 7 looked at the intake of calcium and vitamin D in Midwest America, postmenopausal women living in Iowa in the heartland. 34,000 of them were followed for 9 years. This data was collected from mailed out surveys, but also was food frequency questionnaires. They identified 144 cases of rectal cancer during this time, and they were looking at both the dietary and the supplemental calcium intake. And they found that those with the highest calcium vitamin intake saw a 45% reduction in rectal cancer. So these are pretty big numbers they're seeing in our colon rectal area here with calcium. And then finally, the last study I just wanted to highlight. This is where they looked at over 2,000 people who had those precancerous polyps in their colon. They had not developed cancer yet. And they looked at the relationship between calcium and vitamin D and would they develop cancer. It was a 5-year study. They supplemented them with 1,200 milligrams of calcium, 1,000 of vitamin D, and half the subjects received a placebo, so it was double blind. And they found that supplementing with vitamin D, calcium, or both did not reduce the recurrence of these precancerous polyps. So that did not have a significant effect on these precancerous situations in this particular study. So there you have it. I'm probably as confused as you are about the relationship between calcium, prostate cancer. You know, what do you tell people? What kind of advice do you give? I went to the American Cancer Society's website to really get their statement on things, and you can read it up there on their screen that, you know, some research has linked diets high in calcium and dairy products to a lower risk of colorectal cancer and possibly breast cancer as well. However, studies suggested that calcium in dairy products might, you know, I can't read all my screen here, so I apologize, but you guys can read it all, you know, might put you at higher risk of prostate cancer. And because of this, they cannot make any solid recommendations, you know, telling you should you or shouldn't you do it, because it's almost like, okay, I'm going to take this calcium to prevent colon cancer, but then maybe I'm going to get prostate cancer. So we all remain confused. But what I get from this, my opinion, what I've summarized from it is we all need to just keep a really open mind and continue to question the research, read it. When you hear research, you know, broadcast in the mainstream media, definitely question that. There's probably more to those studies than they're reporting. It is reasonable for most people to aim for 1,200 milligrams of calcium daily with food and supplement combined. There is no real reason that I've ever come across to go higher than this. Too much of anything is rarely a good idea. Based on the studies I read, it might be prudent to limit your dairy intake. You want to always prioritize food over supplements, and just continue to eat as many plant foods as you can for so many other benefits. So that is what I had for today, and I can